everyone, welcome to episode 2 of Patholab. Today's episode is about asthma. I'm Dr. Ahmati, a semester 4 student in Tehran University of Medical Sciences, and today we are going to discuss this chronic inflammatory disorder in the bronchial tree known as asthma. Asthma is a chronic inflammatory disorder of the bronchial tree and airways in which breathing gets periodically difficult due to the widespread narrowing of the bronchi. It is clinically characterized by recurrent episodes of wheezing, breathlessness, chest tightness, and coughing. Asthma is actually very common among patients, but it is a relatively rare cause of death, and this disease usually develops at night or in the early mornings. Now that we know the definition of this disease, let's take a look at the characteristics. You can see episodes of bronchial constriction, which is the constriction of your bronchi, but it is partly reversible. You will see inflammation of the bronchial walls and increased mucosal secretion. Now, we need to know that we have different categorizations or classifications for asthma. First, you can categorize asthma based on the type of antigen into types 1 and 2. Type 1 is atopic, which is due to that allergen, or let's say allergic sensitization. But type 2 is non-atopic, which is without evidence of allergic sensitization. Now, according to the agents or events that trigger asthma, we can put asthma or characterize it into 5 types. Type 1 is seasonal, which means it happens during a specific season. Type 2 is exercise-induced. Type 3 is drug-induced. For example, let's say aspirin-induced, means that if the person takes aspirin, it's going to get worse. Now, type 4 is occupational asthma, meaning that the person, because of his occupation, can get asthma or is more prone to asthma. And type 5, which is asthmatic bronchitis, only occurs in smokers. Now, let's talk about the common types of asthma. The first type we are going to talk about is atopic asthma. In this shape shown to you guys, you can see small diagrams about, or like a summary of what this type is usually like. This is the most common type of asthma, and it usually begins in childhood. And patients usually have a family history of asthma or some allergic reactions like eczema or hay fever. It is a classic example of type 1 immunoglobulin E mediated hypersensitivity reaction, exogenous substances or allergens that can cause asthma, or it can be recognized by us doctors. Now, triggering environmental allergens can also cause asthma. For example, dust, pollen, animal dander, or some specific foods. But let's say that skin tests are very important, because with this causative allergen, you can see the flare and wheal reaction onto the skin. This next type of asthma is non-topic asthma. Well, this asthma has no causative exogen allergic factors that can cause it, and it does not show any allergic sensitization. Therefore, you guys can conclude that the skin test is going to be negative. And family history of asthma is also less common. However, there are triggering effects that can trigger this asthma. For example, some infections due to viruses or some inhaled air pollens, such as smoke or fumes, or let's say some hypersensitivity of the bronchial tree. Now, in this shape, you can see a summary of this type as well. The next type of asthma is drug-induced asthma. Now, I will just explain this very briefly. As we said, aspirin was the most important drug that may induce asthma. Now, aspirin actually inhibits the oxygen pathway of acid metabolism, and therefore it produces leukocytes or leukotrienes. And these leukotrienes that are the ones that cause asthma. The last type of asthma was occupational asthma, which may be triggered by fumes, organic chemicals, or let's say some dusts and gases, or maybe from the penicillin product family chemicals. But you can say that these are the ones that can cause asthma, and you should not actually put these into the same category as your exogenous allergens. We will discuss etiology, pathogenesis, and diagnosis in the second part of the video, so I'll see you in the next part. But please make sure to like and subscribe the video if this content is educational for you. Hello guys, welcome to the second part of episode 2 of Patholab, and we're going to continue on asthma. Now I'm going to focus more on the risk factors and etiology. Now, risk factors for asthma can be into two categories. Either they can be endogenous risk factors or exogenous risk factors, better known as asthma triggers. Endogenous risk factors. Genetic predisposition is a major etiological factor in asthma and creates hypersensitivity to environmental factors. The disrespectable locus is located on chromosome 5, which has lots of genes involved in immunoglobulin regulation in mast cells and eosinophil growth and differentiation. The second risk factor is airway hyperresponsiveness, which means that the airways are too responsive and contract too easily to multiple inhaled triggers, which this does not happen in normal individuals. Now let's talk about gender. So asthma is more common in boys than girls. However, after puberty, it is slightly more common in women than men. And let's talk about age as well, because it's more common here. So about age, most cases actually happen before the age of 25 years. Now that we know all about the endogenous factors, let's talk about the exogenous or environmental factors, better known as asthma triggers. Inhaled allergens, including house dust, mites, and household pets may cause hypersensitivity and or asthma-triggered allergen. Respiratory tract viral infections can also result in this, and pollutions such as sulfur dioxide, ozone, and diesel particles. Passive smoking can also create asthma, such as some drugs like beta blockers or aspirin. Now that we know the important risk factors, there is a question that comes to mind. Is hygiene important in the cases of asthma? Well, children who are actually more exposed to endotoxins in the early years of childhood are less prone to asthma than children who are more safe and less prone to endotoxins. Now that we all know the risk factors and potential factors in creating asthma, let's talk about the steps in pathogenesis. First step is sensitizations, which individuals get sensitive to a lot of environmental factors or environmental antigens, which we call them allergens. The allergen is taken by antigen-presenting cells, such as dendritic cells, and it will elicit a Th2 dominant response, which actually will result to more production of immunoglobulin E by the B cells, and this will also make the B cells that are introduced to this immunoglobulin B to produce more mucosa. Now, these allergens that have been introduced to immunoglobulin will make and release bronchial constrictor mediators, which are, responsible for the contraction and the lack of breath you have in asthma. Also, it will produce these mediators from mast cells, but also you will have the production of cytokines that are responsible for the hypersensitivity we see in asthma. Now you can see in this picture the brief summary of what is happening in asthma disease. Now we need to know about the clinical course. Acute asthma attacks can last up to several hours, and it can go from mild to chest tightness, and it can contain wheezing and coughing with or without sputum production. However, between the asthma attacks, the patient can be asymptomatic. Now we need to know how to diagnose asthma. So you may see a demonstration of an increase in airflow obstruction, you may see difficulty in breathing, which will show itself in coughing or wheezing, and also you can have a blood test to check for levels of immunoglobulin E, which previously we said would be produced from B cells. But also you can check the sputum if the cough has any, and if it is viscous and yellow, it shows that this sputum is rich in eosinophil cells. In this video, we summarize the characteristics of asthma, the important types of asthma, how to diagnose it, and also what to look for in patients, or let's say the risk factors of asthma. Thank you for listening to this video, and please like and subscribe, it will help the channel a lot. See you till next video.